Some types of disease may require quarantine to protect others, such as tuberculosis, whooping cough, and hepatitis A.
Through directed health measures, public health officials can make that happen. But now a bill in the unicam that would change the authority to make those decisions from health officials to elected officials.
6 News' Bella Caracta brings us the debate.
Force mask wearing, restrict business operations, in-person gatherings, school attendance, even how far apart we were supposed to stand from each other.
Those were some of the directed health measures, or DHMs, implemented by health directors across the country. Some believed that elected officials should have had the final say. That includes Senator Kathleen Kauth, who introduced LB 421.
The COVID-19 pandemic brought to light certain flaws in our system. One such flaw is the issue of who gets to restrict freedoms, under what circumstances, and to what degree.
Her bill would require county boards or city councils to vote on DHMs, although DHMs happen more often than you'd think, according to doctors and health officials.
Our local health officers are using their public health authorities all the time. Every day across the country, hundreds of these public health orders, or what we call directed health measures, are issued to keep people safe.
According to the Douglas County Health Department, they issue about 50 to 75 of these a year.
To isolate people with active tuberculosis, to close a restaurant that's using unsafe food handling practices and is poisoning customers, to intervene in environmental contamination issues. So whether it's lead in water supplies or other toxic chemicals, all of these things are actions that public health officers take on a daily basis.
Senator Lynn Waltz from Fremont expressed concerns, bringing up multiple DHMs their health director adopted in response to the floods of 2019.
To set up a protocol for an emergency, all of these things are emergencies. I mean, what emergency are we going to say? You know, in this case, the mayor and the city council members don't have to drop what they're doing.
The city of Omaha already passed a local law requiring elected officials to pass citywide DHMs. The same approval is not required for day-to-day, individual, or small group disease outbreak control. In its current state, LB 421 does not make that same exception. On your side, Bella Caracta, 6 News.
And 6 News also obtained the official letter from the Douglas County Board of Health. The board opposes LB 421, including a patient privacy as concern as well.